Okay, next one is the splenius cervicus. The way I kind of have people remember this is splenius cervicus curvicus, so it kind of actually curves. So the origin is the T3 through T6, so it goes here, and then it goes kind of an angle and kind of curves around to C1 through C3 transverse process. So it goes a little bit closer to the vertebrae. So again, it kind of goes up and kind of angles and back in. And bilateral contraction and hyperextension of the head. So those are the two major actions of the splenius cervicus. So the splenius cervicus is, you remember the levator scapula right here, the superior angle of the scapula. Just go a little bit in, and those are the trigger points. There's actually two of them for the splenius cervicus. And that pain can just refer right around that area for the splenius cervicus. And another referral at the lateral side of the eye, so just lateral to the eye, just in that area. But you remember the suboccipitals, it's like a band, like your sunglasses. But the splenius cervicus, it'll just right in that area for the lower one and the upper one. It will actually go around right to the side of the eye then for the referral. But again, splenius cervicus, another way to splenius cervicus curvicus because it kind of curves then. Okay. Next one is splenius capitis. Splenius capitis, the nice thing about this one, it actually explains where the referral is in a way. So splenius capitis, cap, top of the head, so it'll actually go right to the top of the head. So for the splenius capitis, you got to feel the suboccipital ridge, feel the vertebrae, but actually go out about 2 inches and about 1 inch down or so. That's where you're going to locate that trigger point. And that trigger point will actually go, again, to the top of the head. So the origin is the spinous process, C7 through T3. And then it actually goes, the insertion is mastoid process. Remember the mastoid process, the insertion for the sternocleidomastoid, and also occipital bone for the insertion. The action is bilateral contraction, hyperextension of the head. So those are major ones. So again, if somebody comes in with pain on the top of their head, that's where you're going to have to locate the splenius capitis then.